G'day, my name's David. I'm one of the Partner Physiotherapists at myPhysioSA here in Adelaide, and today I want to have a chat to you about headaches. There's many different types of headaches and there can be lots of different causes. So as a physio, when I first see someone who has headaches, the first question I ask them is, where do you get your headaches? And that actually tells me a lot where they might be coming from. So someone who just says, I get headaches in the back of my head, the top of my neck, straight away that tells me I've got to check their neck, and it probably is due to either stiffness in the spine or tight muscles, and quite often that's driven by poor posture, lots of sustained positions, head down, keyboard, staring at a screen, and your chin poking forward and tightening up the muscles in the back of the neck. So those ones we can diagnose pretty easy, and we do our hands-on work to release and mobilize and get things freed up. We nag them about their posture, we give them the right posture exercises, and we can really make a good difference with those neck headaches. So another type of headache, which also comes from the neck, is a referred headache. So people will say, they might even say they've got a sore tight neck. They'll talk about pain coming up and over, pain in the back of the eyeball, patches of pain or in strips around the head and coming through the front somewhere. So they can definitely be caused from the neck, and the nervous system, it gets a bit confused as far as neck pain goes. Sometimes it actually, instead of feeling it as neck pain, you'll feel it as a headache where the nerves refer to from that section of the neck. So you could be having headaches through the front that are all coming from your neck. Even though your neck might feel normal, you can turn, do all your normal things, it could be brought on from one of those sorts of headaches. So what we would do in that case is we'll do a full assessment of their neck, and by pushing the different spots at exactly the right angle, using some specialised headache palpation skills, we can actually bring on your headache. So if we can push on a certain spot in the neck, it refers the pain over and it's your headache, well, we know it's neck related, and we can get started on treating it, and then we'll look at all the contributing factors like your posture and the things I discussed earlier. So they're definitely necky headaches. Where it gets into a grey area is other types of headaches, so migraines. So migraine, very intense headaches, they come in episodes. You'll normally get some sort of an aura. So that's a sign just before the headache, an unusual feeling, visual disturbance, little flecks in your vision or blurry vision. You can have sensitivity to light. There's a few different types of aura symptoms and migraine symptoms, but the main one is a good old cracking headache and feeling nausea and even vomiting if it's a severe migraine. So that's sort of if you're getting those sorts of headaches or symptoms, it could well be a migraine. The best idea would be to see your doctor, and then often they'll refer to physio, so for some management of it. And the vast majority of migraines do have a neck component to them, so we can actually help migraines quite often with physio treatment. The trick is how much, and there is medications the doctor can give as well, and posture and everything else that feeds into it. So that's a common cause for headaches. Other types of headaches are tension or stress headaches, and they're more headaches that give a band or a tightness across your face or the top of your head, and that's just related to those muscles tensing and tightening up, and that's often stress or anxiety related, people with depression, and again that's about relaxing, learning those signs that a headache's about to start. You can use heat. There's also some medications the doctor can give you to minimise tension headaches. It's amitriptyline it's called, and for some people that can be successful, and once the tension headaches reduce, you can reduce your medication. So learning how to breathe and relax. So we'll see a lot of people with tension headaches and can help them with teaching them our breathing techniques, relaxation, visualization, and they also need to work on the main causes of their stress. So tension headaches are a big one in today's society. Another type of headache is a cluster headache, and they're like mini migraines, and they'll come in a cluster of days to weeks. So you get a big burst of intense headaches that rise and fall and rise and fall, and they're pretty nasty. So if you get them, you definitely need to see a doctor and get a diagnosis, and quite often medications needed for a cluster headache. Again, neck can be involved with that as well. Another area of the body that can give you headaches that's not your neck is your jaw. So if you're someone that clenches at night or grinds, you might not even know you're doing it, but you can get very overactive masseter jaw muscles, and pterygoids they're called, and you've got your temporalis here. All of those working hard at night with clenching or being too tight can give you headaches or facial pain as another type of headache. The last type of headache that you can get is from eye strain. So pretty much sore, tired eyes after you've been reading, or at the end of the day, or rubbing your eyes when you've been on the computer. That might mean you're under some eye strain. So that can give you a headache by the end of the day. So that will strain all the muscles around your eyes and your forehead, and you'll get a tension headache from that. So if you haven't had an eye test lately, you should definitely go get your eyes tested, and it could be that you're needing to wear glasses for when you're on the computer or doing up close work. So if you've got any of those sorts of headaches, you need to get it checked out, because it's definitely something can be done for all types of headaches. There's a few exercises that help improve your posture and stretch out the muscles for the more necky type headaches, and I'll demonstrate a couple of them now for you. So the three main exercises I'd give someone with neck headaches are chin tucks. So chin tuck is where you think about being nice and tall, like there's a string lengthening through your spine, your blades fall gently back and down, which relaxes these muscles, and then from there you slide your chin back, so you're getting a double chin, keeping your eyes level, and then relax. So you do that 5 times, and you hold each one for 5 seconds, and that helps to stretch out the back of your neck and to put yourself into a better posture. And you should actually try and keep yourself in this position while you're on the computer or head down activities, so that you're trying to keep less stress happening at the top of your neck. The second exercise is clasping your hands behind the back of your head, and you're going to lift up as you look down, and I'm grabbing my base of my skull and I'm lifting it up and forward, so that I'm stretching and opening up my neck muscles. And you hold that as a nice stretch, and you can hold that for up to 30 seconds. And that will release a lot of that muscle tightness at the top of your neck. Good. So then the third exercise is one you can actually do when you've got a headache. And what I'm doing is I'm rolling up a hand towel, and you scoop it over. You have the rolled up part at the base of your skull, both hands are holding here, and you're going to do that chin tuck as you're pulling forward firmly with your hands and tucking back into the towel, and you hold that for 30 seconds and then you relax. And you do that 3 times, and that actually pushes right on those top vertebrae and increases a stretch into those muscles, and then you relax. And that can actually get rid of a headache. So if you would try it when you've got a headache, you've got a good chance it'll reduce the intensity of the headache. So you can use that as many times as you want while you've got a headache. So that's a rather long-winded version of what I'd go through with someone in the clinic if they come in with headaches. There's a lot of things we've got to rule out, and there's a lot of things we've got to test before we can really diagnose what's causing your headaches. And then once we know what's causing it, we can start to have a plan of attack to fix it. So the best thing to do, you can try some of those exercises. If you think you've got one of the more serious forms of headaches like migraines or cluster headaches, see your doctor. Definitely follow up with a physio at some stage. If you think yours are more necky, tension type headaches, come on into physio. We can assess them. We can make sure we get a proper diagnosis and work out a plan of attack of what you can be doing to help them. And then we can do some things as well with our hands-on skills to get them settled nice and quick for you. So I hope this has been helpful, and if you need a physio to check your neck and do some work and help with your headaches, we'd love to help you.